So this machine works on a battery. Okay, so once we install it, the battery has to be last long for minimum of 4 years. Okay, so we have only 3 simple buttons. First is, we have 3 buttons. I hope everyone can see that properly. The first is to turn on. Simply, once you turn on the machine will start giving you audio plus visual commands. So this is not anything a trained professional requires. Just because of listening to the instructions, you can go forward for it. Once you click it on,
remove clothes from patient's chest. When patient's chest is bare, open grey plastic case and peel off white adhesive pad.
So it is telling you that please make sure that whenever we are to place the pad, it has to be placed onto the bare chest. Okay? And until and unless you are following that step, it will not jump onto the next step. Simple. Okay?
Open grey plastic case and peel off white adhesive pads. Plug in pads connected.
So I am just changing pads to the training pads because we cannot simulate the cardiac arrest right now.
Training pads.
Okay, so those are the pads. So if we just open this up, we have 2 pads in a one casing, obviously, right? So one pad I have to place it at. Can you see the silver patches on the screen? Okay, so one pad I have to place it at right shoulder. Okay, at the sternum side. On this specifically, the pads is also mentioned under it where it has to be placed. The second pad at the apex side, where we are going to place this patch. So once the both pads are on the patient, that is on the bare skin, it will jump onto the analyzation. So what it will analyze specifically, whether the shock is genuinely needed or not. See, we are the laymen, right? We can make mistakes. Ultimately, machine is going to decide that whether we need to deliver shock or not. So once we place the pad, machine will check that if shock is needed. If yes, then at what intensity, at what joules, at what pace, at what rhythm, everything will get automatically analyzed and it will give you advice that shock is needed, and at that time particularly the third button will start giving you a blink. So make sure that no one is touching the patient and then just click for the shock button. 100 and 150 joule shock for an adult will get induced within 0.4 milliseconds. Now the only point is once you deliver the shock, immediately we have to start with CPR again. Okay, because normally heart was previously beating like this in a normal case. Okay, in cardiac arrest, your heart is not beating right now, it is vibrating or quivering. Okay, the fibrillations has to be stopped. So why we deliver the shock? To remove the fibrillations. Now heart is like this. Do we want this kind of heart? Not exactly, right? So we want that beating heart back. So how we can get that? Again to the CPR. So machine will also give you instructions for that. Once you deliver the shock, immediately start with CPR and it will give you pacings as well. I hope this procedure is clear, because to tell it will take 5 or 10 minutes, but to perform it will take hardly 5 to 6 seconds. Okay, so can we start with this again? Okay, so first we need to turn on.
Remove clothes from patient's chest. Peel white pads from grey plastic case. Attach pads to bare skin exactly as shown. Remove clothes from. Stay clear of patient. Analyzing heart rhythm.
Stay clear.
Stay clear of patient. Analyzing heart rhythm. Shock advised. Stay clear of patient. Press the flashing orange button now. Deliver shock now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Start CPR. For help with CPR, press the flashing blue button.
That manage situations as well. If somebody is not able to recollect that what all steps we have discussed for the proper CPR, so that is also spoon-fed in this machine. So now which button is flashing? The blue one. So if you click this,
place the heel of one hand in the center of the chest between the nipples. Place your other hand on top of the first. Push the chest down firmly 5 centimeters. Keep time with the beat.
so it will pacing, on the same pacing you have to just perform a compression. So no need to worry about that whether we are reaching that 100 and 120 piece as well. It's like a kid's toy. So whichever button is flashing, you'll have to click. Whichever acronyms machine is giving that, you'll have to follow.
Chin and give 2 full breaths.
So these are the breathing instructions. Okay. Now make sure that we can turn the machine on, but again we'll have to turn the machine off purposefully, because after 2 minutes, machine will deliver shock, or machine will advise you to deliver a shock. So if patient is not revived yet, make sure that we should last long for this, and until and unless we are reaching to the medical emergency services, otherwise ambulance is reaching out to the point. And it works completely on a battery. The fully charged battery can last for near about 4 years. At the same time, it can deliver approximately 200 actual shocks. That is more than sufficient for any cases, specifically for the hospitals and for other conditions as well. So we have recently started with deploying these machines into the societies, gyms, clubs, hotels, restaurants as well. Prominent places in Mumbai, specifically airports, metro stations, railway stations, they are already equipped with the same Philips equipments only. So if you want someone who wants to demonstration at their society, do let me know, we can conduct that as well. Any questions regarding to the machine or the CPR? The floor is open. Thank you so much.
Hello, Doctor, how are you? On behalf of Deep Sakhi, I profusely thank our guest speaker, Dr. Vijay Bang, a very well-known cardiologist of international recognition, who, despite of his busy schedule, has taken out time and enlightened us on the complicated and important subject in a very easy to understand way. Sir, with your talk, I am sure we will be able to save our heart from untoward happenings. Good doctors like you replace the fear of illness with trust and recovery. You are real lifesavers. Thanks for showing us so much care and concern. We all know how much of blessings you are to us. Countless thanks to you. I want to thank our founders and committee for selecting a very relevant topic for today's program and an apt speaker for that. Last but not the least, I thank all my friends present here. Now grand finale. We all proceed to adjoining hall for hearty high tea.